Hi, good afternoon, everyone. So lovely to see you all and a very, very warm welcome. Just to set a little bit of background, where the inspiration for today's session is coming from. I think a context setting is very important before we head on. Show you a couple of slides which will give you some insight based on what some of the surveys have told us. And I think that becomes very important to lay the ground for today. So as you would see, we do, I think by now, just by observation, we can very well know that we are growing very fast and the number of people who are above the age of 60 is really growing. And it's expected to constitute as much as 20% of our population, and they would actually outgrow the number of younger adults, kids above the age of 15, they would outgrow that number. And a survey by AgeWell Foundation in 2017 had revealed that every second elderly is highly dependent on the family support system. And every second elderly had cited loneliness as their major concern. And here I'm only looking at the urban elderly, right? And after physical health, lack of social engagement opportunities was cited as their primary concern. And as somebody just pointed out in the chat as well, right? Financial independence, losing financial independence and the need for more financial resources and gainful re-employment were some of the key concerns which were highlighted as part of this survey. And interestingly, there was another survey which was conducted in 2018 which was called the Jug Jug GNA survey, which was conducted, across youngsters who had parents living alone, and similarly those elderly parents who were living alone, they were spoken to. And what you would see here, there was a huge disparity in the understanding of the youngsters about their needs of their parents, right? While 67% of youngsters thought physical health is the primary concern for their parents, only 10% of those elderly parents said that physical health was an issue for them. And as many as 36% seniors said it was their social life which they were worried about. And only 6% of youngsters actually thought that social life was an issue, right? So it really shows how sometimes there is a disparity or a lack of understanding that the youngsters may have about the needs of our parents, and which is where organizations like ourselves have been trying to create sensitization and awareness to help youngsters understand their parents better. So if you would see here, it was like almost 90% of children did not really understand that healthy social interactions or social engagement was an issue, while 70% of elders living alone found their social interactions to be poor or in need of improvement. So this is where we are coming from, and this is the idea behind AMA series to educate the youngsters and help them understand their parents better, and to kind of make this journey ahead as parents grow older more convenient and easy. So thank you so much for joining us. And to you, Dr. Kasthuri.
Yeah, so good evening, everybody. Thank you, Nidhi. And welcome to this session. Actually, it was quite eye-opening, the initial slides and the video which you showed. Very, very happy to see the work that Silver Talkies is doing with the senior population. Okay, I'm Arvind Kasthuri, for those of you who I'm meeting for the first time. I work at St. John's Medical College Hospital. I am primarily a professor in community health with an additional qualification in geriatric medicine. And we run something called the Senior Citizen Health Service over the past many years, 17, 18 years. Currently, I work as the Chief of Medical Services of St. John's Hospital, and that's where I'm sitting now, and I'm speaking to all of you from. So, on with the mission. These are just some thoughts I thought I would share about aging and health as we see it. I come from the healthcare perspective, so I will largely be biased towards perhaps physical health, even though I do in our interactions with older people, recognize the importance of mental health and well-being and financial health and social health. But this will be largely biased towards physical health. Let's see as we go on. Right, so as I said, I bring greetings from the Senior Citizen Health Service. These are some of the pictures of what we do. We run geriatric clinics in about 7 or 8 sites every month, 7 of them in villages and 1 in an urban underprivileged area. We run a small home health service around St. John's Medical College in Bangalore, where a doctor and a nurse visit registered elderly people once every month just to see how they're doing, check their medications, give them a pat on the back and say, don't worry. We run an institutional support service where we visit about 3 or 4 old age homes every month, especially those catering to the destitute elderly run by missionary sisters. We also have started something like an Anganwadi Kendra called a Grama Hiriyara Kendra. In Kannada, that means Village Senior Center in 4 villages in the Bangalore urban district. They function like Anganwadi Kendras, where elders come in the morning, spend the day, somebody is there, a kind of teacher, they take them to physical activity, a little bhajan, a little physical, a little gossip and general chit chat, sometimes including a meal, and then they go back home. And of course, in St. John's Hospital, we do run a geriatric clinic by our Department of Family Medicine. So this is where I come from, the Senior Citizen Health Service at St. John's Medical College and Hospital. Now, just some terminology before we go forward. Elderly, when we say elderly or older person, we mean somebody aged 60 years and above in this country. So there are some standards in the West which use a cutoff of 65 years. But all these cutoffs are chronological cutoffs. And we all know that the truth is not in the number. You can be 75, be very sprightly, you could be 55 or 45 even, and act as if the whole world is on your shoulders. And I encounter that quite frequently, unfortunately, in the seat where I sit now. Gerontology is the study of aging, and geriatrics is the medical science of healthcare of the elderly, opposite, if you were, to pediatrics. So that's just some terminology. Why are we talking about the elderly? I think these slides more or less said what I am about to say, but I generally share this as a backdrop to what we're talking about. And we say elderly people, I know that we have many in our room today. We also have children of elderly people, caregivers of elderly people. Well, there are 3 reasons I believe that we speak about elders. When I speak to our medical students and the trainees that we have in a hospital setting, we have a large number in our country. Now, our population of older persons in India, we didn't have a census in 2021 because of this virus, but we anticipate that we have almost 130 million elderly people. And that is far above the elderly populations of UK and the US. I mean, it's far above the entire population of the United Kingdom, which is about 65 million. So we have a large number of elderly people in our country, and that number is rising. The proportion of elderly people, like Nidhi shared, is growing from about 10% of the population currently to, and we anticipate that it will hit 20% by 2050, which means every 5th person will be an elderly, every 5th Indian will be an elderly person, which is quite a large number. Also, from our perspective of healthcare, the prevalence of chronic disease or the burden of chronic disease in elderly people rises with age. And this is just 3 bars showing you acute, chronic, psychological morbidity or illness. And these are percentages of prevalence of among people aged 60 years and above. And as you can see, those percentages are quite high. And therefore, because of these 3 things at least, we need to discuss, talk, and come up with something that we can do for our elderly population. So in this session, we will discuss the relationship between common complaints in elderly people and the age-related changes that occur. I mean, we all know that aging is a phenomenon which is universal, whether you like it or not, we age. But there are certain things which we accept as normal aging, but certain points beyond which it's not normal anymore. There is something wrong here, which we need to do something about. And we try to see what we mean by that. And also perhaps some suggestions for a better aging experience. So what are the changes that take place in key areas of the body as we age is the question that we will start from. Now, I had three options to look at how to address this. I mean, do I start from top to bottom? Do we say physically, let's start with the brain and the head and go down to the eye and the heart, etc.? Do I go somewhat more medically system-wise, the nervous system, what happens in the cardiovascular system, what happens, etc.? Or do we look at this question in the light of what we commonly encounter in our interactions with elderly people? And I thought that I'd choose this option. And if we were to ask what are the top conditions or the top complaints we get from our elderly people, this is what we most commonly see. Musculoskeletal problems, disorders of movement, bone, joint, it pains, my hips pain, my knees ache, that kind of a thing. Vision and hearing, arguably a very, very big part of all the illness seen in elderly people. Chronic heart and lung related issues, which we call cardiovascular and respiratory medical language. Digestion, the gastrointestinal tract, the food that we eat, the feelings that we have about food and things like that. And of course, memory and brain related issues, genitourinary problems, and lastly, skin issues. Now, these are probably the top 7 areas of problems that we see among elderly people that we interact with them. So I thought I'd use this framework to discuss this, taking them one at a time. I thought we'd look at what are some of the common problems that we hear pertaining to this group of systems in the body. And what could be some of the possible reasons for these from a normal aging perspective? And then, of course, being in the medical line, I can't resist giving a prescription for what we think that you can do as you go forward in this area. So let's start with the muscles, bones, and joints. Some of the common things that we see is the weakness syndrome. As we grow older, I'm feeling weak. I can't really manage to do what I used to do earlier, what we call the weakness syndrome. Then pain deep-seated in the bone, which could be this condition which we call osteoporosis. Pains in the joints, very commonly the knee joint. As we grow older, we do see a lot of patients saying that, when I walk, I find that my knee hurts and I'm not able to walk as fast or as well as I used to earlier. And of course, this whole issue of falling. And this was a session that we had earlier with Silver Talkies, where we discussed how we can prevent falls in elderly people. So these are some of the syndromes and things that we see commonly. Now, what are the things that happen in our body as we go on? Now, we know that bone is a structure in the body which is a very dynamic thing. Even though it looks like there's a solid bone there, it's actually all the time losing cells and gaining cells. And it's a sort of like a bank account. You take out, you put in, you take out, you put in, kind of a thing. And just like, unfortunately, many bank accounts with age, that starts to shrink. And the bone metabolism, as we grow older, results in the bones becoming a little weaker. And that when that becomes extreme, that is the condition that we call osteoporosis. And not just that, in the joints, there is this layer called the cartilage, which sort of cushions the interactions between two bones that come about in a joint. And that cartilage thins out as people grow older. And the range of movement, pain, all these things start to step in at that point. And balance and gait, that is our walking, our balance, our coordination, all these things start becoming little issues, again, not maybe related directly to the bones and the muscles, could be due to other things. When our vision is diminishing, for example, or our sense of hearing is diminishing, and therefore we've got a little bit of an issue seeing things properly, and therefore we are feeling a little imbalanced. That could also happen, right? So these are things which normally happen as part of normal aging. So what do we do about it? Well, this exercise is in capital letters, and you're going to see it. I'm warning, I'm issuing a statutory warning. You're going to see that word come about very frequently in the prescriptions that I'm going to discuss with you. I believe that 30 minutes every day, at least on most days of the week, of just walking, and at least 2 days of some form of strengthening muscles. And I think Silver Talkies must have had sessions which tell you how to strengthen muscles in terms of using maybe a dumbbell or using something which you try to keep your muscle strength intact. So exercise is a very, very key component of keeping our bones and joints going. A diet rich in calcium. Calcium is found naturally in dairy and dairy products like buttermilk and curd and milk. Paneer and stuff like that. It's also found in green leafy vegetables, ragi, if you're into eating ragi. These are some of the sources of dietary calcium. And let me tell you, you can buy all the supplements you want in the planet, but there's nothing as good as getting nutrients from the diet. You can underline that. Calcium supplements are fine, but never as good as dietary calcium. Vitamin D is again found from the sunlight, but vitamin D supplementation can be helpful, no doubt about it. Vision and hearing, well, some of the common things that we see, watering of eyes. My eye keeps watering. It's sort of irritating. And of course, reading glasses and difficulty seeing. Hearing loss, I think, is a fairly common complaint among elderly people, and also inability to differentiate between certain types of sound. Now, why does this happen? Well, as we grow older, the eyelids become a little lax. There are muscles and tissue in the eyelids that becomes a little lax. And even tears in our eye are a dynamic process, which means that there's a constant secretion of fluid and a constant draining of fluid happening in the eye as we see during the day. And sometimes what happens is that channel gets disturbed. There is tears formed, but they're not being drained off very clearly. And that results in a little tear overflowing over the lower eyelid, and that results in this phenomenon of watering of eyes. Now, we all know that the lens of the eye, as we grow older, starts to become a little cloudy, and that's the condition we call a senile cataract. The retina, which is the layer of the eye behind what you see, the back layer of the eye, that becomes thin. And there is a condition called age-related macular degeneration. I mean, it's a complicated term, but that refers to the back of the eye and the part where the light actually falls. And that sometimes can get degenerated. A ring around the cornea, that cornea is the transparent portion of the eye. It's called an arcus senilis. All this is normal aging change. The hearing sensory apparatus becomes weak. The nerves conducting the cells which conduct sound become a little weak, and that's the basis for what we call presbyacusis, or age-related hearing loss. And the wax in the ear becomes a little hard. So obviously, especially if you have conditions like diabetes and high blood pressure, we prescribe an annual eye check. That's the best way of taking care of your eyes, just to see inside the eye, put the light and look inside, look at the outer part of the eye, best done with an eye doctor whom you see regularly. Glasses as prescribed. So many people are prescribed glasses, but leave them all over the place, don't use them properly. They get broken, but are not replaced, things like that. Hearing. It is good to check your hearing. If you think that somebody is not hearing, don't dismiss it as, they're like that, or no. Sometimes it can get corrected. A hard piece of wax or something blocking the ear can be removed, and the hearing improves dramatically. So check your hearing. And hearing aids, well, you know that they're a sort of a double-edged sword. They don't work anything as good as the regular ear does, but they can be useful in many people, and it's worth a trial of a hearing aid at least. Cardiovascular, heart and lung, well, these are some of the things that we see. I'm taking BP medications, sugar medications for so many years. Do I have to take it lifelong? What is this? And, so-and-so is a heart patient. Are elderly people more prone to getting pneumonia and persistent cough and phlegm? These are some of the things that we encounter in our geriatric clinics. Well, the prevalence of high blood pressure simply rises with age. Now, that's something we don't know why it happens. But to an extent, some of our blood vessels become a little thick. It's like a pliable vessel becoming thick and therefore less sort of able to adjust to changes in blood volume and things like that. So the blood pressure starts to rise. Heart muscle becomes slightly stiffer, and our maximal heart rate reduces. That is, how fast the heart can beat starts to reduce as we grow old. Now, all this is normal aging. The lung elasticity reduces, and the bony cage, that is our rib cage outside of our chest, can sometimes interfere with the way the lung expands, and therefore how deeply we can breathe and how we generate a cough. Well, if you have high blood pressure, if you've been diagnosed with high blood pressure and are taking medicines for it, check your blood pressure or your random blood sugar at least once every month. Otherwise, once in 6 months to a year, if you are not diagnosed with these conditions, should do. Medications as prescribed, don't tinker with dosage and schedule. Don't say that, no, I don't think this, so let's change this, because it's done with your best interest in mind. If you think that something is irking you, then best to take it up with your practitioner. Deep breathing and yoga, I'm sure, again, Silver Talkies must have had sessions of things like this. I think that they are wonderful for the health of the lungs. Exercise, like I said, 30 minutes every day, at least for 6 days of the week, is a great thing to do. Now, digestion and gastrointestinal tract, food is one of the great things in life. I mean, I know that many of us relish food, and there's nothing wrong with that. There's this whole guilt complex that many of us develop around food. Well, moderation is a good thing. Nobody's saying no, but that doesn't mean you've got to be too hard on yourself. So food is one of the great things, but then they say that I find it difficult to chew, difficult to swallow. I sometimes get a little heartburn. I feel that I have gastritis and little swelling of my stomach. Appetite has reduced. Constipation is a very, very important, commonly encountered problem in the elderly, as also incontinence, which means the passage of stool without one's knowledge. Now, what are some of the normal things that happen? Now, in our mouths, the layer that we see, the pink layer, is called the mucosal layer. And that sometimes, it does thin as age goes on. Our teeth do decay and some of them do become loose and fall off. Our salivary glands don't secrete saliva as much as they did earlier. And that leads to a dry mouth, difficult to swallow again because of the lubrication. The esophagus is the food pipe which goes from the mouth down to the stomach. And the movement of that esophagus sometimes gets a little restricted as we age. The place where it goes into the stomach has a sort of tight muscle which allows nothing to go back, but that muscle becomes lax, allowing food to go back, and you feel a reflux, kind of as if something's coming back, Stomach sensitivity becomes higher, and therefore a little more gastric acid and irritation. The lower digestive tract, which is responsible for stool and bowel movement, becomes slower, and therefore constipation is something that can happen. And we find that many of our people don't drink enough fluid and eat enough fiber as they should. So we must find the diet that suits each one of you. Maybe softer, maybe easy digestible food. Fluid and fiber are very important F's. We must ensure that we drink enough water and take enough of salads and vegetables, because that gives natural roughage, which keeps our colon, that is our lower gastrointestinal tract, in good health. We must check with our doctors if all the medicines, now many of our elderly patients have long lists of medications, some of which may not be required. So check with your doctor to see if all those medicines are required. Coffee and tea after about 5:30 is not a great thing. It can lead to a little bit of heartburn. And exercise. You won't believe the number of systems which are improved with exercise. So memory and the brain, very, very commonly, I mean, we all forget things, but how up to what point is this normal is a question that is very, very commonly asked. I know that somebody mentioned dementia and Parkinson's disease. These are some of the common conditions we see. Well, as we grow older, the brain volume actually starts to reduce. Brain shrinks as we grow older. But that doesn't mean our functioning is interfered with in any way. In fact, it is not. And that's the beauty of the brain. It manages so beautifully with whatever resources it has. The brain cells and connections also reduce. And there can be an accumulation over the years of damaged and harmful products, which is the basis for what we call Alzheimer's disease. And some aspects of memory are very well preserved with age. Like we know, many of our distant memory is very well preserved. It's only recent memory, short-term memory, which gets a little affected. Attention span and multitasking abilities are a little hit. Well, it does help to keep the brain active. Use it or lose it is a commonly used saying, and that holds good for the brain as well. It does help to keep our brain active, do puzzles, learn new things. Involvement, friendship, social activity, belonging somewhere, all these things are very, very good for the mind and the brain. Some amount of memory loss is inevitable, but the point where it gets disturbing or you need to check is when it affects activities of daily living. That is, I'm not able to get up and go to the toilet. I'm not able to independently use the toilet. I'm not able to bathe, dress, eat. I've forgotten even what that is. Now, that is when perhaps memory loss goes into significant cognitive decline, or what we call dementia. Now, we must discuss caregiving and support options, and exercise helps the brain. Remember that. Genitourinary system, urinary incontinence, urinary tract infections. These are very commonly encountered problems. And of course, sexual dysfunction. Now, our urinary bladder, which is the place where urine is stored in the lower abdomen, finds it difficult to contract as age increases. There's a slight decreased power to contract. So all the urine is not pushed out each time. The muscle to hold back the urine, that is that valve at the end, weakens. And that's when you sometimes find that when you cough, a little urine goes out. And that's because of that muscle becoming a little lax. There is a predilection to urinary tract infection. It's a natural thing with aging. And in women, the reproductive tract can become dry and prone to infections of different types. In men, the prostate gland increases in size, which is again normal aging. But when it gets to a point where there is a problem, you're not able to void, or you run, but you're not able to pass, things like that is when you bring it to the attention of the profession. So the prescription, well, there is this pelvic floor exercise called Kegel's exercise, available widely on YouTube, how you should do it. It's a very good set of exercises to practice to build up the pelvic floor muscles, avoid incontinence. Now for men, prostate size, like I said, when it gets alarming, we should check, and prostate specific antigen or PSA levels at least once a year or once in 2 years. Fluid intake after 6 o'clock. If you drink large amounts of water, you may need to go to the loo very often at night. And if you are on a diuretic, which is a type of tablet which causes urine output, check with your doctor whether you're taking it correctly, right dose and right time. Lastly, the changes in the skin. Now, dryness of the skin and itchiness of the skin is a very commonly encountered problem. Easy bruisability, wound which does not heal very fast, and of course, those who are bedridden, bed sores. Now, what are normal changes in the skin? The skin thickness reduces with age. The ability of the body to produce sweat and lubrication of the skin reduces again with age. The blood vessels immediately under the skin are very fragile, and sometimes they rupture, and you get little bleeding spots dark spots under the skin, which some people are very alarmed about, but generally they are harmless unless they are associated. They happen very regularly, very large, or very frequently. And the supportive structures and fat under the skin gradually reduce, which is why our skin starts to sag as we grow older. Now, where we should help to keep the skin moist, especially in seasons like the winter, where the air is very dry. Mostly dryness of skin is what leads to itching, and we must keep it moist using oil or cream or whatever you normally use. Excessive use of soap and rubbing of the skin vigorously with a towel is not a good idea. It leads to the skin becoming drier and drier. Any sudden changes in color, size of moles or birthmarks should be brought to the attention of doctors, because it can mean something else. The feet are arguably an extremely important part of the body, and we must look after our feet and the skin of the feet very well as we age. Now, these are just, like I said, common presentations, common reasons, common concomitants of normal aging, and some sort of prescriptive thoughts for you. So I'll pause here, Nidhi and company. Back to you, Reshmi. I think you're moderating Q&A. Go ahead. I'm open to questions. Ask me anything is the name of the series, but I did warn Nidhi and Reshmi. Ask me anything, all right? And I don't know, I'll say I don't know. So go ahead, ask your questions.
Sure. Thank you so much, Dr. Kasthuri. Thank you for that very enlightening presentation. So without wasting any time, let's go straight into the questions. I'll take the first one from Nagendra. My father, aged 91, suffered a stroke 8 years ago and is becoming more and more incoherent with advancing age. How do we help him cope with this?
So a stroke, like all of you probably know, is a sudden change in the blood supply to the brain. And that can happen very abruptly, it can happen gradually. And what happens is that one area of the brain suffers a lack of blood and can be either temporarily or permanently damaged. Now, if it's permanently damaged, then some part of the body corresponding to what part that brain supplies is affected. And if it is the area which controls speech, then the speech area, the speech function gets a little affected. Now, what can we do with respect to what we call deficits or neurological deficits or sequelae of strokes, whether they are in the physical movement realm or speech realm, is what we call neurorehabilitation, which involves basically physiotherapy from the point of view of physical deficits, but speech therapy in the case of neurological or speech-related deficit. So at this point, Mr. Nagendra, I can only answer this saying that, yes, it does get incoherent as they go further, because probably the function starts to diminish in that area more and more. But the only way forward is to support that whatever existing speech with patience and a good speech therapist, but also the rest of your father. Always remember that a person with a neurological deficit also has the rest of his personality many times intact. So we must pay attention to the rest of his needs to reassure him, saying that don't worry, this is okay, we are trying to deal with it. That kind of a support plus speech therapy is what I can say at this point in time, and I'll stop there for now.
Thank you, Doctor. We hope that answered Nagendra's question. Now, Shobita's is not exactly a question, but I'll read out the statement, as many people have this problem. My mother-in-law comes up with all kinds of diseases which doctors cannot understand. Is this something you commonly hear among seniors? They feel there's something wrong with them.
Yes, if I had a rupee for every time I found a complaint which was not described in a textbook, I'd be a rich man by now. Yes, people do encounter problems which are not necessarily described in the textbooks, but that doesn't mean they don't have a problem. is what I try to tell my residents and younger faculty. Just because we haven't defined it medically, that doesn't mean it doesn't exist. So yes, when somebody comes up with a lot of questions and issues which medical science does not seem able to resolve, the chance is that perhaps it may not be a serious physical illness. It could be something to do with the way in which that person is perceiving his or her life, the way that person is perceiving his or her time, and the abilities that she or he have, the vocations, the use of that time. And perhaps the answers lie more in those areas rather than in medicines and drugs. So I would say that, yes, it is normal. I mean, let me reassure the person who asked. We do get a lot of senior citizens who come with questions for which they don't seem to be medical answers. But we try to reason with them, to try to be as patient as possible and understand and say, don't worry, okay, I understand you have a problem, but I don't have a medical solution. So let's try to see what we can do non-medically. And perhaps the answers lie in diet, in exercise, in involvement, in getting socially active, in meditation, whatever. Those may be the ways in which those problems can be handled rather than by drugs and medications. Yes, Rashmi.
Thank you, doctor. So Vijaya's question is, should we consult a psychologist for Alzheimer's?
Yeah, Alzheimer's disease is one of the causes for the syndrome called dementia. Just like when we say fever has many causes. It could be COVID-19 now. It could be dengue fever. It could be malaria. It could be typhoid. It could be a common cold. It could be many things, but the syndrome you see is fever. Now, just like that, dementia is a syndrome which results in the decreased ability of somebody to use their mind, to think and do things based on the brain. Now, that again has different causes. And one of the causes of dementia is Alzheimer's disease. So if somebody has been diagnosed with Alzheimer's type of dementia, then yes, she does need to see at least anyone between a psychiatrist, a psychologist, and a neurologist. Now, these three specialties are slightly different. All of them deal with the brain and the nervous system, but look at slightly different aspects of the problem. And I would say that between these three, you would come to a conclusion as to what needs to be done for somebody with diagnosed Alzheimer's disease. Now, there's not too much in terms of medication that can be offered to a person with Alzheimer's disease, but there is a lot, and I'm sure the caregiver knows this the best. There's a lot of support that is required in terms of care, both physically and with food and with everything, activities of daily living and the rest of it. So to get that, what exactly we should do and how we should support this, a combination of these three people with perhaps a physiotherapist and a social worker, if possible, would probably give you a holistic view of what you should do for someone with diagnosed Alzheimer's disease. Yes, Rashmi.
Thank you, doctor. That was very helpful. Meher has asked, why is choking while eating common and how to prevent this in elderly?
Yeah, choking while eating. That's what, like I said, the swallowing reflex is actually, whenever I speak to medical students in the early part of their careers, and you describe the human body to them, you can't help but be amazed at the way in which this whole thing has been designed. The swallowing reflex, for example, is such a beautiful thing where you put food in your mouth, you chew it, and then as the food goes to the rear part, and that also is organized so beautifully, it is presented to the teeth, and the teeth grind, cut, and chew. But the tongue, while doing all that, it gives it here, gives it there, gives it, but the tongue itself doesn't go in between the teeth. That's a fantastic thing. And then slowly the tongue pushes the food back like that, gradually towards the back of the throat. And when the food reaches that area, a nerve picks it that hey, food has arrived at the back. I better start this whole process going of swallowing. And then the windpipe is closed and the food pipe is open. At the same time, a muscle gets activated to push the food into the food pipe. The food pipe closes, the windpipe opens, you start breathing again. Now, this is not something that we do consciously. It just happens subconsciously. Like now, for example, I just swallowed. And when I swallowed, all that just happened. Now, when somebody, as we grow old, unfortunately, that reflex doesn't happen that smoothly many times. And that's the reason why sometimes the food is not fully swallowed, it's still there. And the windpipe is open. Now, the windpipe is not the pipe which takes food down. It takes air down into your lungs. And if a food particle gets into the windpipe, your body doesn't like it, and it agitates in the form of a cough. And you violently cough. You say, oh, something went the wrong way, you say. And that's what has happened in that gentleman when he tried to swallow. But unfortunately, not all the food went in, but a little bit stayed behind and went into the windpipe. So now what do you do for this? Well, smaller morsels, perhaps, of food and not big pieces of food. Chew well, swallow a little bit at a time. These are just small pieces of advice, but it's good to be vigilant, not have this habit of lying down and eating, watching TV and eating. These are things where which make it a little worse, because then the position also is such that it can interfere with the way the food pipe and the windpipe work. So I would say that simple things like that, eating smaller morsels and chewing well before swallowing, would probably go a long way in preventing choking. Yes, Rashmi.
Thank you, doctor. Have heard that regular use of CBD helps ease all the symptoms you spoke about. Any opinion?
You mean cannabis oil? Do you mean that?
I think that's what it is, yeah.
Oh, okay. Yeah, well, there's been a lot of interest in cannabis oil. Yes, right, I know. Yeah, thanks, Andrew, for that question. There has been a lot of interest in cannabis oil, but to speak from evidence-based medicine, Anju, at the moment, I wouldn't say that a drop of oil or a grain of oil every day does wonders. Well, I'm not able to say that with all confidence because I don't have the evidence to back it. But I do know that it's a phenomenon that's making waves, and I'll have to stop there, unfortunately. Yes, Rashmi.
Thank you, doctor. So the next question is from Sushil. He's asked, what about any natural mood and depression medication to help seniors overcome depression?
Well, medication, now depression, remember, is again a term which has many shades of black or white or gray as you look at it. Everybody feels depressed. I feel depressed many times sitting in this office. I'm looking at, now we have 180 COVID-19 patients admitted in St. John's Hospital as we speak. And so therefore depression comes and goes. But the question is, when does it become noteworthy, or when do we need to do something about it? That's where, again, with all things, when it comes to a point where it affects your daily life, that is, I'm not able to think, I'm not able to function because I am feeling low in mood continuously. And that's when depression becomes something which needs to be taken very seriously. And the prevalence of mental health problems in elderly people is also reasonably high. So I see where this question is coming from. But the treatment of depression is not all medication. There is a lot of treatment before medication for depression. One has to first understand what type of depression this is. Does it warrant medication, or can it be helped through perhaps psychotherapy, which is speaking, understanding, why are you feeling depressed? What is the cause of this? And seeing whether, in fact, a medication is required. And if a medication is required, yes, then it is required. But then that is a decision that has to be taken after careful evaluation. Because the wrong medications taken in the wrong dosages and the wrong time can worsen some of the symptoms of psychological illness. That's the danger which we need to be aware of. So therefore, I wouldn't say yes to your question. I would say that depression requires to be evaluated before it is treated.
Thank
Yes,
you.
Rashmi.
Thank you, doctor. Rajesh has asked, my dad is 86 years old and had a heart stroke 10 years ago. He is losing strength in his legs and finds it difficult to walk even with a walker. I help him do some exercise morning and evening for 20 minutes. What can be done to gain strength in his legs and avoid a fall?
I think what you're doing, Rajesh, is wonderful, which is being there to support your father when he or she has had a stroke in terms of assisting him to exercise. I'm sure you've had physiotherapy consultations and physiotherapists visit you, but I would really recommend one when I say that in the recent past, if you haven't had a physiotherapy consultation, or if you've had the same guy and he doesn't seem to be giving you anything else, maybe you can consult another person and say, would you have any suggestions for me to maintain the strength in my father and preserve his ability to walk for the longest time? So that's one way to go. It is all in the realm of physiotherapy. To answer very simply, it depends entirely upon how much we exercise, how much we get muscle strength back in your father's legs and give him the confidence to start walking. And a good physiotherapist can actually do that. But there is a certain amount of inevitable decline in function which will happen over age. We've got to accept a little bit of that. But before accepting that, we need to be absolutely convinced that no, nothing more is possible. And that's where I would think a good physiotherapy consult would help. Yes, Rashmi.
Thank you, doctor. We have another detailed question from Vinda. My father, aged 85, suffered from a sacrum bone fracture a month and a half ago. He has been put on PTH injection therapy and calcium tablets since then. He has developed irritable bowel syndrome and has been using adult diapers. His MRI shows nerve bundles are normal. Can you please advise?
Well, that's a little PTH or parathormone therapy is given to enhance the strength in the bone. That's the reason for giving that therapy, those injections, probably daily. And calcium supplements do help the process somewhat, not dramatically, but a bit. They do help. So if you're giving those two therapies to your father, you can be assured that yes, we are building up his bone strength. But further to that, to say that his MRI shows that his nerve bundles are normal is a good thing. Okay, if the nerves are not affected or not compressed upon and all that, that's good. But I'm afraid beyond that, at this kind of an interaction, I wouldn't be able to suggest anything. I think you're on the right track when you say that you're giving parathormone injection, which will build up his bone strength. And you are obviously consulting with somebody who has taken care of that sacral bone fracture. I would just recommend that you continue consulting with that person and see what they come up with. Yes, Rashmi.
Thank you, doctor. Sunita has asked how to avoid DVT when immobile.
Yeah, well, deep vein thrombosis or DVT is a condition where clots form in the deeper veins of the body. That is the veins typically inside the calves, for example. And the danger with deep vein thrombosis is that those clots can dislodge, go up, rise up into the heart, and then get out from the heart into maybe the brain or maybe the heart muscle itself, causing a heart attack or a stroke. And that's the danger of DVT. Now, how do you prevent DVT? Again, it's a question of muscular movement. One of the problems with prolonged stasis, which means prolonged periods of rest, where we just don't move from a couch or a bed for long periods of time, is clot formation in the deep veins. So as long as we keep moving our legs, keep exercising our calf muscles by perhaps, frequently moving the foot up and down, that sort of, compresses or massages the calf muscle. That helps the blood flow to keep going. Walking itself is a good way of massaging the calf muscles and keeping blood flowing. Prolonged stasis, prolonged inability is the danger for DVT. And if you avoid that, you should be avoiding DVT. Yes, Rashmi.
Thank you, doctor. So since you answered Binda's question just now, she's just asked, and there's one more question that come, which is connected to IBS. Is there a way to manage it?
Irritable bowel. Sorry, that's what she had said, the sacral fracture. Now, irritable bowel syndrome is a, I mean, just between me and you, it's a relatively less known syndrome as to what we do about it. We can describe it. That's what we know about. What exactly it is? Well, it is a syndrome where people feel like frequently they're going to the loo, the bowel movement is frequent, sometimes diarrhea happens frequently. All this is described, but what exactly causes it and why it is there and what we can do about it, well, it's difficult to say really. So if your father is used to wearing diapers, that's a great step in itself, because many people suffer silently with fecal incontinence because of irritable bowel. But you need to check whether the incontinence is due to IBS or due to something else. And I'm assuming that if somebody has said it's IBS and use a diaper, that means they have probably ruled out any other causes of why he's losing stool without his knowledge. But at the very least, somebody needs to examine his colon, his lower colon, perhaps do a colonoscopy and see if there is anything causing the fecal incontinence. And if all is ruled out, then we come with a diagnosis of irritable bowel. And unfortunately, there's not too much therapeutic options for IBS. That's what I would like to say at this point, Rishma.
Thank you. There's a question that's come connected to IBS, which says, is there any diet that could help with IBS?
Well, we generally say soft, easily digestible, fiber. Now, fiber again is a double-edged sword with IBS. There are some fiber-rich foods which apparently seem to worsen it, some which make it better. So there isn't any single kind of dietary approach to IBS. Unfortunately, we'll have to sort of seek and find the best kind of solution for a given individual for what diet suits him or her the best.
Thank you, Doctor. Sushila has asked, what are some good things we can do to help an elderly person with Parkinson's who is increasingly losing control over movement?
I know Parkinson's disease can be very distressing both to the caregiver and the patient, because movement is involuntary many times, and people sometimes violently move their arms, legs, head, neck, and all these things without their control. It can be quite distressing, there's no doubt about it. But the route for Parkinson's disease is through a good neurological consultation where we look at Parkinson's therapy. Now, Parkinson's disease is caused by a deficiency of something called dopamine. And we try to substitute that by giving external dopamine in the form of the tablet called Syndopa. I'm sure anybody with Parkinson's would be using something like that. But sometimes those tablets themselves have side effects, and those side effects are worse than the disease itself. And that's where a good neurological consultant helps, balancing the drug side effect and the disease itself, and trying to find the right dose and the right combination of anti-Parkinson's drugs to find the best fit. So it is distressing, I agree. But one has to accept that that is the form of the disease. I mean, that's how the disease manifests. And it's treated like this with these medications. And again, supporting the patient and saying, don't worry, I know it is distressing, but let's do our best, is the way in which one can offer some confidence to patients with Parkinson's disease. Yes, Rishmi.
Thank you, Doctor. So Sudhir has asked a question in two parts. My father is 77 and had bypass 16 years back. He also has a knee problem. So the first part of his question is the age of bypass 10 to 15 years? And do you have to get it done approximately after 15 years? That's part one. And secondly, is he a good candidate for knee replacement surgery? Will he be able to bear it?
Okay, taking one at a time. Well, there is no real fixed lifespan for a bypass graft. It's entirely depending upon how the heart is functioning, how the blood flow is happening, what is the current position of current state of the graft. Is it patent? Is it flowing well through it, or is it starting to get a little blocked in the edges? And I'm afraid that the best person to answer that would be the cardiologist who did it, or some other cardiologist who would ascertain whether that graft is working well and does it need any intervention at all. May not require a second bypass graft, but at least to see whether an angiogram is required to look at the patency of the blood vessels. That's a question which you can probably ask your cardiologist. The second had to do with the knee. Now, knee replacement is the last step in the knee osteoarthritis journey. If it is deemed by your orthopedic surgeon that nothing more can be done in terms of, that is, the knee is almost continuously hurting when you move it, movement has become extremely restricted, walking has become a big chore, it's not possible to use the knee, it's so painful, so immobile, so stiff, then is when we would, a conservative approach would think of knee replacement, though there are those who believe in a more aggressive approach, which takes it a little earlier. But would he be a candidate for knee joint replacement? Well, anybody is a potential candidate for knee joint replacement if they don't have any of the risk factors that rule them out for major surgery altogether. But that said, I think it's a question of evaluating the current state of the knee and seeing whether it is at a position where there is no other physiotherapy or medical way of managing the osteoarthritis. If there is absolutely nothing, then yes, knee joint has to be replaced.
Thank you, doctor. So Rakesh has a question about his mother, who's 73. She has high cholesterol and triglycerides. She has tried various statins, but the side effects of the statins create issues that affect her daily living, different kinds of aches and pains, lack of sleep, etc. And they have stopped giving her these statins. What he wants to know is if there are other ways of managing high cholesterol and triglycerides apart from taking statins.
Well, cholesterol is a funny thing, like the evidence goes this way and that many times. But by and large, yes, it is an acknowledged risk factor for heart disease, high levels of cholesterol. And that's why people are very trigger happy in trying to bring it down. But always remember that it doesn't necessarily work that way. At the end of the day, each individual's body and how it reacts to its own levels of various things, its own bloodstream, differs. It's not that both of us have the same level of cholesterol means both of us have the same risk of heart disease. No, there are several other factors which come into it: the genetics, the other lifestyle issues, the state of our hearts, the state of our blood pressure, the state of so many things come into determining whether a person's high cholesterol is going to cause a problem or not. So if statins are not tolerated by somebody, then fine. Yes, don't give them statins. But are there other ways to manage cholesterol? Yes, I'm sure, been talked about diet and physical activity. I'll just use those two. Absolutely nothing more than that is required. If the diet is healthy in terms of fresh vegetables, fresh fruit, low levels of saturated fat and red meat if you're non-vegetarian, and all that, definitely benefit cholesterol levels without the need for statins. And 30 minutes of exercise every day would definitely build up HDL, a good type of cholesterol, and bring down LDL levels. So diet and physical activity, if rigorously followed, definitely be a good alternative to statins if somebody doesn't tolerate them. I think the earlier gentleman did put a question on the chat box about the age being 77, therefore knee joint replacement. Well, again, it's all a question of quality of life. Now, what is the quality of life currently of a person? Suppose he's very sprightly, he's very well. It's only this knee osteoarthritis which is keeping him from doing what he wants to. Then probably he would benefit the knee joint replacement surgery. But if that person is not very mobile, otherwise got a lot of other comorbid conditions which are not going to lead to a dramatic increase in physical activity after surgery, then perhaps you need to think about it. So I leave it at that.
So one of the questions that came to us earlier was, my 65-year-old mother has started experiencing severe knee pain, but refuses to consider surgery right now. What could she do on a day-to-day basis to feel better?
Yeah, well, this is what I'm saying, in the sense that it's a question of how functional is the knee, and if she's feeling pain on just walking even small distances, not able to use the knee, slowly becoming immobile, then we simply have to consider surgical options. But if the person is not willing, then what are the other options that we have? We don't have too many. Remember that the pain in the knee is because of a condition called osteoarthritis, which means that it's a degeneration of the knee joint, wear and tear. So the cartilage has become probably thin, it's worn out, so to speak, in the edges. And what can we do to a worn out joint? It's very difficult to actually put back the cartilage, make the joint young again is difficult. That would probably be impractical to consider. So we've got to look at what existing function is available in terms of muscles around the knee joint, the muscles of the thigh, the muscles of the lower leg, and try to strengthen those, what we call quadricep strengthening, hamstring strengthening. Okay. So like I was saying, it's a question of building up the muscles around the knee. Exercise, it seems to be a simplistic thing to just tell somebody, no, you got to exercise, but that's a fact. The right exercise, not just exercise, but the right exercise for the knee, the right physiotherapy for the knee, and maybe, there are a few medications which are supposed to help build the cartilage in the knee joint, which can be tried. So those are the ways in which we can try those are things we can offer to somebody who's reluctant for a surgical procedure on the knee. Yes, Reshma.
Thank you, doctor. I think we'll take last two more questions. So here's another one that came to us earlier. So this was basically about appetite, that, my elderly mother's appetite is gradually reducing. And is this, is it a cause of worry? And there are various appetite, any enhancers which are suggested. So do they help?
Well, appetite loss is a concomitant of normal aging. There is a certain amount of loss of appetite in terms of the amount that a person can eat. Sort of slightly comes down as we age. It's the body's natural response to a slowing metabolism, right? But that said, if the loss of appetite is acute over the last week or two, somebody has suddenly lost appetite, then we need to see why. We need to investigate the person, check him or her physically, check his stomach, and look for why there has been an acute loss in appetite. But if it's a gradual loss of appetite over many months or years, that you can assume is a concomitant of normal aging. What you need to monitor is the weight of the person. Has he been losing weight acutely over the last weeks or two? There's been weight loss of more than maybe 5% or 10% of his body weight. Then we get a little into an investigative mode to find out why there is this weight loss or appetite loss. So I'd approach it like that. Appetite enhancing drugs and medications, no. I don't feel that they are of much use, and I don't think that we should encourage them. Drugs is not the way to go as far as appetite is concerned.
Thank you, Dr.
Yes.
One last question, and if we have been unable to answer all your questions, you can email them to us, and we'll of course have other AMA sessions in future. So this is from Juthika. My father is 80 years old and has been put on 3 statins 4 years ago. He complains of giddiness, especially during night when he wakes up for nature's call. She has checked this with his doctors, and they say that he is all right and there is no cause of worry, but he still feels that he is falling off. So what could be the issue here? And what would you advise?
Again, giddiness is a common complaint in elderly people. It could happen due to many things. I mean, the causes of giddiness in elderly people range from within the brain to within the ear to within the height, within the joints. So many reasons why a person could feel giddy. But a person getting up at night to use the toilet, an elderly person getting up at night to use the toilet is a very, very common phenomenon, like all of us know. Now, the things to keep in mind while that happens are the following. When you get up at night, okay, before you go to bed, are you taking in the evening any drugs or medications that may lead to giddiness? Now, I'm assuming that the doctors who are treating him have clarified this. They looked at his prescriptions and said that, no, there are no drugs and medications which are causing giddiness in this person. So let's rule that out. Then, when he or she gets up at night, the way in which he or she gets up is also important. If he suddenly rises from a lying down position to a upright position, that can lead to a drop in blood pressure. All of us have experienced that, I'm sure. When you suddenly get up from a sitting position, sometimes you feel a little woozy for just a few seconds. Now that's because the blood pressure drops. It's a normal thing, and immediately it picks up again and you feel okay. Now in an elderly person, that reflex takes place a little slower. So the advice that we give is get up slowly, sit first for about half a minute, and then slowly get up. Keep something next to the bed to hold on to when you go to the toilet. It could be a walker, it could be a stick, it could be a chair. I know many people who keep a chair, their favorite chair. There's a lot of elder people who have favorite chairs which move as they walk, kind of a thing. But they like that chair because it's at the right height and they know all about it. And they know exactly how much weight they can put on that chair. So whatever it is, some supportive device, assistive device kept next to the bed will help in this dizziness or giddiness phenomenon. But if the giddiness persists to the level where somebody is in danger of a fall, then we need, I'm afraid, to really see further and see what could be the problem. Do we need to give a medication for the giddiness? Is this vertigo? Consulting an ENT specialist perhaps to see whether there is a certain amount of giddiness from the ear. And other causes of giddiness would be the way to go. But remember what I said in the first part, and see if we can handle it at that level. Yes.
Thank you, doctor. One last question on high BP. Somebody has asked any first aid or remedy to reduce high BP when it suddenly shoots up?
Well, no first aid really, but make a person lie down, keep him or her calm, open buttons at the neck, loosen clothes, put the fan on, ventilate the room, reassure the person. These things and ask the person to take deep breaths. So if somebody does this and there is a reassuring air around the person rather than an air of panic, it helps greatly in reducing blood pressure. So I would say that first aid wise, that's the way to go. There's nothing else that you need to actually give somebody with an acute high blood pressure as part of first aid. Medication is a different thing, but first aid, this is what you do. Ask the person to lie down, ventilate the room, air, quietness, deep breaths, reassurance, and call for help. This is what would be the first aid for high blood pressure.
Thank you very much.
Lovely, doctor. We have actually been able to tackle all the questions that came to us. So thank you so much for your time. And before everybody leaves, I must tell you this, that Dr. Kasthuri, other than being the Chief of Medical Services at St. John's Medical College Hospital, he's a team lead of the St. John's Geriatric Center project. He's also the mentor for Senior Citizen Health Service, and he's also a professor, and he teaches. He's very passionate about teaching. And in his personal time, he also is part of the Cause Foundation and the Kiara Academy of Performing Arts. He promotes musical theater in Bangalore and Mangalore in support of charitable causes. He also has been part of multiple research papers nationally and internationally, and has been a recipient of the Venkoba Rao Oration Award of the Indian Academy of Geriatrics on 2 occasions. So thank you so much, Dr. Kasthuri, for your time. Needless to say, I think it has been a brilliant session. You have been able to really answer all the questions that came. And I don't think we had a situation where you had to say, I don't know. So it's been a wonderful, wonderful session. Thank you so much. And I'm going to bother you again sometime soon.
I'll work on that. I don't know. I better practice it once or twice. Anyway, thank you, everybody. Thank you, Nidhi. Thank you, Reshmi. And to all the senior citizens out there, all the very best. Don't worry. There are people there for you when you need them. So God bless Silver Talkies. Thank you very much.
Thank you.